Okay. Wonderful. Right. Good morning. I welcome all of you for this CME lecture organized by the Candy Society of Medicine. We were delaying little few minutes because of to have a crowd come, because there's a 5-10 minutes delayed last few weeks. That's why the delay. Now, before I introduce the speaker today, I have two announcements. One is that we are having the certificate course on tuberculosis on 13th of this month. And we are limited numbers because there are many more trainees to come and join. If anyone is interested to come and participate that certificate course, please get your registration very early. Otherwise, you may not be able to come into the system because of there are many more coming as a particular trainees are joining. So this is good for all the doctors, whatever discipline they belong to, because the TB is the universal problem. And there's another workshop we are going to organize, the brain death workshop on the 21st of this month, and the detail will be announced later. The brain death, because a brain death assessment is a very important, all the basic doctors. So we are going to organize a brain death workshop again on 21st of this month. It will be helpful to each and every doctor who is practicing medicine in this country and in the world. Now, without taking much time, and today welcome all of you for a lecture, exercise and a challenge for overweight and obesity. As given by the postgraduate training, the Dr. Asela J.B. Ratnayaka is currently registrar, sports and exercise medicine in National Hospital, Kandy. Now, actually, Asela has this interest of exercise and this particular field for several years. I know him for several years, and he is the graduate from the University of Peradeniya, and he has a diploma in sports medicine, Colombo PGIM, and he has a diploma in fitness and nutrition, Thomson Education Direct, Philadelphia, United States. And he has a fellowship in sports medicine, the University of Medical Center, Utrecht, Netherlands. And he has a lot of publication, and he has published and presented papers locally and internationally. And he will be the future consultant in this particular very important area of medical discipline. And Asela will going to update us and enlighten us on this particular field. And we had lectures on nutrition some 1 or 2 weeks before, and this will be definitely adding into the information what we gathered the last 2 weeks before. And I am inviting Asela to present this lecture. Thank you.
Good morning, and first of all, I would like to extend my gratitude to consultant chest physician Dr. Dushanta Madagathara sir. Thank you very much for giving this opportunity. In fact, I think this is the obesity has become a global problem today, and especially if you can recollect your memory after the COVID-19 epidemic, because even though we are still not cleared fully, but you might have realized, because we at your domestic setup, your children, maybe your husband, wife, maybe siblings, you know how much they have gained the weight, and this has become a real problem in all over the cities and the villages and everywhere. So I think when this lecture topic was decided, I think it is a timely topic. I mean, other than the normal epidemic like obesity also become epidemic, but in addition to the our COVID problem. So when I come into the very direct approach to the problem, actually in different age groups, and especially the physical activity and its benefits has been clearly defined by many research, and especially with the American College of Sports Medicine, that the exercise is medicine expert document. And you can see in children, especially, it is very important in weight status and the adiposity. So when it comes to the middle age and active age group, there are so many benefits you can see through this particular screen. And I would like to highlight, especially my topic, especially the weight status in the middle and the active age group. So it's reduce the risk of excessive weight gain and weight loss and the prevention of weight regain, which is we are going to talk about a very important topic, the weight regain, because the most of the problem comes when it comes to the weight control. And some people like tend to lose their weight, doing so many of activities and the interventions for weight control. But the problem is they come in maybe 3 months or 4 month time, so we are gaining the weight again. So this is a big problem. So we know that in current concept, then how much interventions and the new research and the evidence to protect it and how to control your weight. And especially when it's come to the normal activities, so we are going to address beyond that activities, of course highlighting the importance of some normal activities as well. So if we are defining this particular exercise, so what is an exercise? Exercise is defined as a subset of physical activity that is planned, structures and repetitive, which goal of improvement of maintenance of person's physical fitness. So when it's come to the physical fitness, there are 5 components that you can see here. So that is actually the flexibility, cardiovascular endurance, muscle endurance and muscle strength, and the body composition. So in body composition, the lean mass and the fat mass are the areas that we are going to address when it comes to the weight reduction, because what we define as a healthy weight reduction is actually without losing your lean mass or your muscles, we need to actually get rid of your fat, or we would say the health risk fat. So that is the primary idea. So having this knowledge, so I would like to highlight some important facts, especially the WHO public health experts consultation, because even though this was published in 2004, you can see the BMI values for Asians and also for the other the populations, because underweight it is less than 8.5. So when it's the optimal weight, it is the same, and slight difference it 20, almost 29, and this is 25. But when it's come to the overweight category, we should know that is Asians are 2 points below when compared to the other recommendations. Especially in the pre-obese situation also, we are having 23 to 27, almost 28, and but in other WHO recommendation it was 25 and 29 for the others. So in obese also we are using these indicators. So it's important because when we are planning an weight reduction program or managing the BMI based program, so we should little bit have some additional weight compared to the standards value when it's come to the Asians. And especially the Asians has a very special condition, of course the others, but the abdominal obesity, they have given the waist circumference and the waist to hip ratio. Again you can see the differences, and all these things WHO recommendation is 102 when it's and 88 for females, and Asian Pacific consensus, because in our region so it is much less, and in the Caucasians the values are different. But especially the waist to hip ratio also has some differences, so we should have this idea before we actually treating our patients. So our primary goal of exercise in obesity and weight is to reduce the weight, so that is by fat loss. So in our recommendation, usually we go by this recommendation, but depends on your clinical practice and your client's knowledge, and also with the especially with the compliance and other factors has to be considered. So 0.9 kilogram, even you don't need to go for 1 kilo per week. So you can go actually this slow weight reduction or 10% from your baseline value over the 6-month period by expenditure, additional 2000 calories per week outside the normal daily activities is the recommendation. So by doing this particular weight reduction, that's a slow weight reduction, or according to this, because a lot of research has been done and the chances of weight regaining is less. So we can actually also apply to our patients these values. So when it's come to the exercise prescription requirement is obesity, so we need few basic things to be cleared, because ideally, because sometimes you can deviate from this thing, but for the sake of knowledge and also the best practice, I would like to elaborate these things. Of course, you have to do the medical clearance. We do initial risk assessment by the PARQ. I will show you the how to do it, and to assess the level of the obesity and the overweight, and appropriate assessment of physical capacity to engage in this exercise. And also, especially when it's come to the obese people, there's a lot of humiliation, because if you advise them to do the exercises, it's very difficult for them to do exercises equal to the where the non-obese people are doing, because they might find difficulties because their range of motion, their balance, their capacities are quite different, and they significant different than the normal people. But you should very careful about before you actually prescribing the exercises. So you need to have the customized or maybe the modified exercises for this particular group. So this is the PARQ format. Actually, it's a very simple. Now we have actually PARQ Plus by actually 2020, but this is also accepted because this is published in 2017 onwards. And you can see there are only 7 questions, because only just have to just to tick by the patients, and you can just having some idea if there is something. Yes, you have to really consider about doing to the next step, that is the pre-participation medical examination. Just to highlight actually, so this is very important, because where we actually, if anyone who fail in the PARQ form, then we are actually, he will be step into the medical clearance to be done, and especially the recommendation of the exercise program, because there are so many other areas has to be considered when you come to the PP. Sorry for this. This doesn't work because it comes in the new format, so it doesn't work. So just bear with certain the areas with the new technologies also. Right. So before I get into the exercise real in obesity, I would like to give you a basic idea of the type of exercises, because very important. The aerobics and cardio exercises, and also that is also just walking, brisk walking, cycling, swimming, and all these comes into this area. And the resistance exercises, which is a very important thing, and a lot of people do think actually it is not important for exercise programs. So just walking, or maybe 2-3 kilometers, maybe 30 minutes walking might be enough for me, and I don't want to engage of any. But you will realize at the end of this presentation, it is equally important, or maybe sometimes more important than aerobic exercises when it comes to the especially the obesity and the overweight. So there are different kind of resistance exercises. Isometric exercises considered as static exercises, where your muscle length doesn't change. You just contract the muscle without changing the length. And the isotonic is muscle contraction where you change the muscle length. And isokinetic is a special exercises which difficult to do without a specified machine, which we don't have at the moment at Sri Lanka, which called the Biodex machine and all these things. But you can do the similar exercises using the resistant bands. And the calisthenics are defined as the exercises that use your body weight to do the exercises, like push-ups, squats without any weights. And also the machines, if you go to any gym or any gymnasium or anything, you will find a lot of assisted machine and the free weights and the resistance band. And one might not forget the importance of yoga, Tai Chi, and Pilates like exercises, because it has become you don't need to do the 100% yoga session, but of course there are some yoga exercises which can incorporate very easy to your program, uh, and we will see some of the videos actually how those can be incorporated. The scientific approach to the exercises is done, especially the universal accepted exercise program, and will fit formula will be talk about these things, and smart protocol is applied in many other occasions. Exercise module. So I think you should know this actually is a very important. One should start with a warm up session and incorporate into some of the stretching exercises. I mean, these are rough times because depending on your capacity and your environmental factor, you can, and then you engage in primary activities. And at the end of the exercise, you should do your cooling down session. Remember, especially the overweight and uh, obese people has to use uh, soft terrains. For an example, if they can run or walk on a grass based ground, that is much advisable than run on a tar very hard surfaces. At the same time, because we always advise them to use a very good quality shoes, because the shock absorption quality has to be high, otherwise with their weight and also the ground reaction force which is coming back can damage their cartilage, and also the joint problems can come and the appropriate attires. So so exercise prescriptions should be done in fit formula. I think in my previous presentation the last year I just highlighted these things. So this also comes like a prescription of a medicine. You know that we define the name of the drug, and we do the dosage, and whether it's the frequency and also how long. So likewise, frequency, intensity, type, and time. So these are actually the four factors which we consider when we prescribe exercise to any individual, because otherwise you will miss certain areas when you prescribe an exercise model. For an example, frequency, how many days per week, and intensity, how hard that exercises should be done, carried out, and we'll see this is the area where we don't consider much, and type of exercises, and the duration of the exercises. So when it's come to the aerobic cardiovascular exercises, so I don't need to, because you all know this basic, just to recollect the memory. You use your large skeletal muscles, use of oxygen, and prolong exercises, less intensity, but remember it's a rhythmic motion. For an example, walking, jogging, running, swimming, aerobic dancing, and all these things come into this category. And there are so many ways of measuring those things. I'll highlight few areas how to actually identify your intensity guidelines. So you can see the mild, moderate, and strenuous. So there are very subjective measures. Of course, you can do the talk test when you are doing exercise. If you can able to talk or sing, so that is mild. And if you are able to talk but not sing, so it's considered as moderate. But this is very subjective, because depending on your physical fitness and the activity, so this can be done. And even cannot talk or sing, so that means you are engaged in a strenuous phase of exercises. So if the rate of pursuit, that is the RPE box, because we have 20-point scale and 10-point scale. And of course, less than, when it comes to the 20, less than 10, this 20 scale start with 6, go up to 20, but not with 0. Less than 10, it is mild, and 11 to 16, it is moderate, like that. So you have physiological relative measurement, especially with the heart rate, and also the some other advanced level like heart rate reserved, and also METs. And everybody knows how to define METs, and especially when it's come to the less than 3, 3 to 6, and more than 6 are considered as mild, moderate, and strenuous respectively. So this is the RPE actually Vogue scale. So this is, as I mentioned, 6 to 20, and they have categorized whether it's mild, moderate, and strenuous. So this is the 0 to 10 scale, where actually the modified scale, because sometimes some people come across with certain difficulties to interpret that, and they have modified. Now at the most of the time even you can use this one, and these are very readily available things, the sources even you can download from the anywhere in the internet, and the resources. So in obese people, what we actually wanted to start with a very safe zone. So you can see here, when it's come to this zone, weight bearing impact, like running, step aerobics, skipping, and all these things, this cannot be done with the obese people. And the risk and the calorie burn is even though high, but you have to start with the non-weight bearing and a non-impact exercises first, and with the safety measures first, and then you can gradually come into the your right side hand up to weight bearing or low impact exercises, and then it come to the higher exercises. But it takes some time, but it's better to start always with these exercises and come into the safe zone. So these are other exercises actually which we don't have in Sri Lanka. Some of these things you can see, the treadmills are being made using a water tank. The idea of this actually, if the obese person get into the water tank, it's very important, because the water, the Beyonce effects of the fat and the fatty person can have the least impact of their joints, and it's very easy for them to exercise. But you start with a very high level, but over the time actually you lower the water level and get the more impact and more strenuous work. This can be done even in our simple swimming pools, because this cannot be applied even sometimes the rural areas, but of course the urban areas, yes, you can advise your patient to go to the swimming pool and go up to this level, their neck level, and you can walk inside the pool. So this will be burn more calorie, and also the Beyonce effects will, the floating effects will, have a less impact for, and you are walking, your energy is wasting against water rather than the air. So you will burn more calories and get lot of benefits out of that. Of course, the same thing, because we had a one student, 16-year students, he's into the morbid obesity category. He's from Tambul area. Actually, when we inquired him, he actually preferred to go to one of the water streams to bathe every day. That is he's from rural area. And the advantage of, we advise them to walk against the water. Water stream is coming from down, and he just, he didn't swimming, but actually swim, but he walked against the water. I mean, even you don't need to walk. Sometimes even if you can, stay still, but still you can burn a lot of energy, and especially when it's come to the diabetic patient, sorry, obese people. And these are actually safe exercises even other condition, osteoarthritis like conditions also. So these, I want to highlight some of these, because you can see the lipid metabolism during aerobic exercises. Actually, if you do a mild to moderate exercises, we all know the increase of energy requirement is high. So you can see the 5 to 10 fold increase of fat oxidation above the resting amounts if you engage in moderate exercises. So you can see here the very clearly. So why we try to highlight and to tell our people to do little bit extra amount of exercises, because some people tend to do 20 minutes, 15 minutes, they think that is enough. No, absolutely, we have to go for more than 30 minutes if you really wanted to burn your fat. Because in this very clear graph, you can see in this research, so 30 minutes, this is your resting level, and you can see the amount of increase of the fat lipolysis and the fat oxidation in 30 minutes time. You get a more than 5 to 4 to 10 fold sometimes. And you can see the difference here, because that is the lipolysis and also the fatty acid uptake. So you can see here actually it is also been increased a lot, and also in the similarly fatty acid uptake by the skeletal muscles also been increased. So that is why you have to very clearly tell your patients with obesity and overweight, you have to go for more than 30 minutes of exercises to get your fat oxidation and lipolysis to be increase into the very higher fold and do. So I have seen some people actually they engage in treadmill run or some of the gyms, and use a gym also because specified. If you go to few gyms in Kandy, you can run only 20 minutes because they want to get it to the other client the opportunity to run. So this is not going to work because they will not get the benefits out of that. So therefore it is very important, even if you can go to 60 minutes and plus, and your fatty acid oxidation and also the fatty acid uptake by the muscles and also with the lipolysis also more when compared to the resting level. So these actually this done in 2011, the isolated aerobic exercises and the weight loss. So systematic review and the meta-analysis done, and it says the moderate intensity aerobic exercises program, this is up to 6 to 12 months, induces the modest reduction of weight and waist circumference in overweight and obese population. But they say in 2011, what they say was if you do exercises, it has a very minimum effect of reducing your weight. It's a controversy. And but we will talk about some of the research which has been done 2018 and 19, even 20, and their picture and their inferences are much different compared to these values. But still, isolated aerobic exercise provides modest benefits of the blood pressure and lipid levels and may still be effective weight loss therapy in conjunction with diet. So ideally, that is why I highlighted, because many people believe I just walk about 2 kilometers, maybe half an hour. So that's enough for me. And even in the walking tracks, even in Colombo, Kandy, and so many places, people just walk only. And they come out and they tell, okay, my weight is still the same. I just walk for about last 6 months, maybe 1 year. So I'm not getting the benefits out. So therefore, it is very important to understand the other areas, other disciplines which has to be incorporated into this weight reduction program. So few things about the resistance exercises. The resistance exercises is actually you apply some resistance to your normal functioning or the normal movements. That is by adding some weights or some resistance band or something. Actually, it improves your muscular fitness and it is anaerobic nature. Actually, sometimes it's measured by the repetitive maximum. That is how we measure it. But usually, when it's come to the exercise prescription, we don't go by measuring RM. But of course, you have some apps today. You can actually do some data inputs and you can get the maximum output. So this is actually obesity guidelines for resistance exercises. So in the same way, frequency you need to only for do maximum of 2 to 3 days per week. You don't need to do every day, like 5 days or maybe 7 days, like aerobic activities. And volume is actually 2 to 4 sets. Repetition and sets, you can go up to 8 to 12 repetitions. And this is actually you don't need to actually consider about the scientific facts when it comes to the normal people. You can just advise them to start with a tolerable weight, and you can go up to 15 repetitions one set without tired. If you can do it, that means you can step up your exercise, the weight into the next capacity. That's fine. So that, as I mentioned, calisthenics, free weights, resistance band, and all these exercises are advocated here. So these are some of the calisthenic exercises. I think this is not moving actually. These are all okay. These are calisthenic exercises for obese people. Actually, you can do these are moving the cartoons like exercises actually, but it doesn't work here. Straight leg raises you can do with very safe region, and you don't need to go for a full range, which is very effective, and you can change your legs, and especially the squats. You don't need to do free squats. Actually, you can keep a chair and very safely you can sit and up down and do about multiple repetitions. Knee rolls are actually you keep the knee like that, and the knees are move rolls on either side of the body, and you can even try to touch the ground on either side, which is a very safe exercise for obese people. And hamstring curls are, you know, do it in this manner, because you just flex the knee and ground down, because you don't need to actually do much, because you know your own weight has a lot of resistance capacity to actually build up the next level. So these are some of the modified exercises which I'm try to show you the display. Yeah, right. You can see, because especially when you are doing the movements exercises, and you can actually modify your exercises and minimum the weight over your spine and the lower limbs, and also by the same time, because it is adding some weights on the forearm as well, because these are modified way of exercises. And you can see, because over the time you can increase the range of motion, because these modified exercises all help to actually, you can see now she's more leaning down and keep the elbows here and start exercises, because that actually give other forms of uh, and you can see some other exercises, cycling and all these. Sorry for the inconvenience with the new technology, because I cannot upload here, because the person who is managing there who uploading the videos. So, okay, if I mean, at the end of, if we log out from that, I'll try to at least to show to the audience here. And especially when you apply the resistance exercises, it is important to apply on the progressive resistance training rather than, doing the same weight or the same resistance for a longer period, because you will adapt, the body will adapt to for the next challenge. So remember to apply this progressive resistance training when it's come to the resistance exercises. So there are so many resistance exercises actually you can do. So you can see these are the resistance band. Actually we have, if you have the resistance band in different resistance, because it comes in a color code, you can use the way that you want, especially with the moderate, like you, it comes with a light green up to pink and yellow, sorry, the purple and also blue, and at the end of it's a silver. So you can use the different the resistance band, of course, without even a single machine or a free weight. You can do the full body workout with this resistance band, because I think in future with the KSM, we would like to do some these sessions, practical sessions with you, because we have the pharmaceutical companies which actually import these brand, and also the local companies which actually do a very good program, and you will realize you don't need to go to a gym. Even at your house, your room, and you can have only about 2 by maybe 4 by 4 area, and you can do the entire body workout without a single machine, without going to any other places, and in a safe manner in a COVID period in your home. So it's just a matter of spending few money, maybe about maximum of 5,000, maybe less than 5,000 or 3,000 rupees, because then you can actually do these exercises. And you see different exercises even in obese people. You can do these machine assisted exercises, which I'm not going to highlight, but we'll try to do some additional, especially when it's come to the effects of resistance training. So you can see the change in energy expenditure and physical activity in response to aerobic and resistance together, because you can see how these effects are being very prominent when you adding the resistance exercises to your aerobic exercises. You can see aerobic exercise results in a higher energy expenditure during the exercise bout compared to the resistance exercises. Result in the present study emphasize the benefits of resistance exercises in long term. So that is very important, because that is why people come to us without results. So if you add this one, of course you can get a very good results without any problem. And the resistance exercise has also been associated with more pronounced increase in resting metabolic rate compared to the aerobic exercises. People think that doing aerobic exercises only increase the resting metabolic rate. If you wanted to get rid of your fat, if you can increase your resting metabolic rate, so that is one plus bonus when it's come to the reduction of your fat and gain the healthy weight reduction. And the other advantages of doing resistance thing is because your lean mass is being preserved and it is being much more stronger, and you will get much more even the outer appearance. Because if I think most of the people try without doing any exercises, they try to restrict to the dietary plans, and they do various type of dietary intervention, and you can see through after a couple of months time if they really work for them, and you will see how cachexic they are, and your out appearance is not that pleasant. So therefore, even on those aspects, it's very important when it's come to the obesity management. Of course, the flexibility is another challenge in obese people, because their structures are so bigger than the normal people. They cannot go to their normal range of motion, and it is, I mean, these kind of people are suffering so much, even their private life, their sexual life, and their skin problems, and so many areas. So therefore, it is very important to introduce the flexibility exercises in very early stages, you can assist the Swiss balls and all these exercises, but with their limited range of motion, over the time we can increase their capacity of flexibility. And the balance and proprioception is another very important thing, because if you get your body fat or the body size so high, your center of gravity is shifted to a different place, especially when it's come to the abdomen, is shifted to the anterior and more lower compared to the previous, the original place where you tend to fall. And the impact of falling, and they are, especially when it's come to the obese people, and their injuries are more severe than the normal person because of the impact and the body weight. And very important for us to actually develop these kind of things are even now available in Sri Lanka. The Bosu, this is called Bosu, and you get balance board and all these things, which is not necessary for these people, which is a very highly skilled people. But of course, you can do some single stance test, eyes closing and with arms banding, balancing. These are very important thing, because if you develop their balance and proprioception sensation, very easy for them to engage in higher level of physical activity and the exercises, especially for these people. So uh, overall physical activity and exercises prescription, we do special consideration for uh, obese people, especially balance and proprioception exercises for their, especially for the lower limbs. So NEAT, actually non-exercise activity thermogenesis. This is a published in 2019 by the Healthy Lifestyle Center. It's a USA based uh, publication, but of course we know many of those things. You can see the amount of energy actually we should spend by doing various activities. So it is important consideration when goal to increase the physical activity when it's come to the lose weight, because you cannot sometimes prescribe each and every person a standard exercise schedule. So you deviate from that and select some normal day-to-day activities, maybe home gardening, maybe washing your car, maybe just staircase climbing. So many, and you can even do the hiking. So many areas, and also the recreational activities are being incorporated into your program. It comes as a NEAT, non-exercise activity thermogenesis. And idea of this program is to 1 pound of body fat is equal to 3,500 kilocalories. So you try to actually burn at least 200 kilocalories per day. So for an example, walking 2 miles and decreasing the calorie intake by 300 calories per day. So you are increasing your energy and also decreasing your calorie intake. So ultimate goal is to actually get the 1 pound for fat loss per week. But what we recommend is to go for 2 pounds per week. So that count actually the 900 grams roughly. So therefore, it is a very good example. But you can see the energy expenditure when it's come to the different activities. Sitting, you can see now we actually few of our sports medicine colleague participated in one of the seminars, the exercise seminars in Singapore in 2 years back. Actually, in their conference hall, they had only 50% seats, because in every lecture, so the people who are sitting will be standing and the people who are standing will be sitting. So this is how they promote their, the reducing the sitting time. Even if you go to schools, even if you go to libraries and many working places, now they actually getting out of this sitting position and do the standing. Even in schools, in the libraries, they remove all the chairs. Students has to use the library half an hour period with standing the tables. So even in working areas also it is the same. So sitting is one of the biggest risk factor today, actually identified for NCDs as well as the obesity and overweight. So therefore, we promote, actually it's very good for doctors, I think, who are doing very good ward rounds, like about maybe 3 or 4 hours, and our standing time is comparatively very good, very high in ward settings. But that is the problem with the clinic settings, and anyway we have to think on those lines. So you can see standing compared, it's a double, maybe 3 times the volume that compared to your sitting time. And if you do some even gum chewing, you can see the masticator's muscles has fair amount of energy production and wasting using your energy compared to when you're sitting and standing. So I mean, I don't know the other aspects of this the gum chewing, because you have to go for a healthy, there are some chewings. So remember, because some people, even if you are taking your meals, now the current advice is to chew well and the swallow it, because otherwise, some people with a quick meals in the morning, especially our people, they just gulp their foods and run. Okay, and when you come to see your plates, it's empty within seconds. So they don't chew it and use the masseter muscles especially to burn their energy. So these are areas actually where that in by 2019 these have been identified and introduced to the people to burn more energy. So it's good to eat, but with proper chewing. So this is another area where I wanted to highlight. Actually, now even if you take number of step count per day, so what is our recommendation is at least to go for 10,000 steps per day. So it's very easy to calculate, because you don't need to actually think about a lot of things. If you take your smartphone, most of the smartphones today, it's on your screen, it will show how many steps that you have gone up to this level, because every day, even in the midnight, it will become zero, and it will start with the new counting. And every time your phone is with you, if you walk or do anything, so it will count your step count and give you, or otherwise you can have a pedometers like that. It's also very you don't need to spend a lot of money. Now it is 600, like 700, maybe less than 1,000 rupees you can purchase, and you can put it in your belt or somewhere, or it comes as a pendant or something, rather than having so many other things. These health values, equipments can be wearable ones, and you can actually count your step count. If you can achieve 10,000, it's good for general health. But if you can adding some additional, normal, adding some up to 11,000 to 14,000, that will be really benefit when it's come to the weight loss. So this is a very, very practicable area. And most of the times what I do is actually, when I go home, I will realize that I have been only walk about 6,000 steps, maybe 7,000. So I will take my, the leisure time, maybe 1 hour or 2 hour. Maybe I'll try to walk or do some exercises, and going to, because my residence is close to this Polgolla Dam area where you find another walking track. So I used to complete at least to that another, the 3,000 or the 2,000 which I missed. So actually you can do those things, like rather than going by walking and counting the steps. So that is to idea is to complete 10,000 minimum, so normal health. But if you wanted to go additional weight reduction, 11,000 to 14,000, I think it's very easy you don't need to every updated, like now the current smartphones has this function. If not, you can actually download, it's the free app, you can easily download, and it will be every time when you go there somewhere, it will count your step count. So these are some of the activities. Actually, this is important fact. This is the kilogram, the weight by kilograms of the individual, 70, 80, 90, 100. So if you go by these values, you can see by doing 30 minutes activities, different activities, how much energy that actually they can burn with calories being actually displayed in this particular the graph. And there are different, you can see Tai Chi like activities, even cooking. You can see if you are obese, you can burn a lot. Dancing, golfing, like activities, aerobic, and you can see walking normal, walking little brisk walking, and you can see, because more have weight, you will burn more energy. So it's a basic concept. So expected initial weight loss and possibly of producing clinical significant weight loss from different modalities of exercise training. So this actually give a very good idea about our weight loss, because you can see the pedometer based step goals, you can gauge very low weight loss, which is, but clinical significant weight loss is unlikely. You know, the clinical significant weight loss comes if you reduce your 5% of your body weight from your baseline, we consider it as a clinically significant weight reduction. But you won't get a clinically significant weight reduction by doing only the step count. So you have to do the aerobic exercise training only possible, but you have to do little bit extra. But you can see resistance training only, you won't get the clinically significant weight reduction. But if you combine both, of course, again, you can get, it is possible, but if you can actually combine with even the calorie restriction or dietary restriction into this program, of course, you can get a very good result. So the message of this research is actually, if you want to have a clinically significant or very significant weight reduction for your obese or the overweight patients, you have to advise them very clearly diet plus exercises together with aerobic and resistance gain combination. So this is another meta-analysis actually done in adolescents, and you can even see some of the, actually the highlight of this research is to the each met hour week per week was associated with 0.13 the BMI and 0.33 kilogram decrease of BMI and the body weight respectively. So you can see, because there are so many research has been done, especially combination of exercises, and you can get many new results. So our weight loss program, physical activity or exercises, actually the summary of program is this. This is a very important slide, I think. Physical activity to prevent weight gain. So you have to engage in minimum of 150 to 250 minutes of exercises per week. So for an example, if you engage in 5 days, 30 minutes per day, so that's complete your 150, and you should go a little bit higher. So if you want to really lose your weight, so physical activity 150 per minute promotes minimal weight loss. And if you can more than 150 modest, and you can see 225 to 420 up to very high level of physical activity, you can get a significant weight reduction, which your goals can be achieved. And physical activity for weight maintenance, that is another important thing. So if you want to really, once you achieve your goal, you cannot stop it. You have to do the maintenance. So what their recommendation is, you go up to 300, 200, 300 minutes per week of your physical activity exercises program. So this is actually the summary slide. So this is actually engaging people who are really engaged in these activities, because this is another area where actually the exercise impact of weight loss adaptation to the energy gap. So there is lot of new theories has been came out. Actually, this is published in 2018. You can see the adaptation to weight loss promoting weight regain. So that is the area where we have to be consider. So there are so many adaptations from the hypothalamic neuropeptide expressions, decrease sympathetic neurotone, especially, and into the resting energy expenditure, and so many areas, actually responsible for when you lose weight to gain the weight again. And if you do the intervention through exercises, you will realize, and it attenuate your energy gap, and actually it help you to prevent this weight gain, and through various mechanisms they have prescribed. And it's a very clear new research finding. You can really go through this research if anybody who likes to go through by this very molecular level of explanation. again, another meta-analysis you can see here, done in adolescents, and you can see this is actually meta-analysis done using many research findings, and exercise plus nutrition A, exercise only, and nutrition only intervention with changes in BMI values. And you can see all these results. And of course, if you go by the nutrition only in this here, it is actually not really addressed. You can see this dotted line here. I think it's clear for you. And ultimately, but different values is the positive in favor for intervention. And you can see the final results actually, if you go by, so this is, it comes to the favor for the intervention. And if you go by the body fat percentage, the same meta-analysis, it also shows exercise plus nutrition and exercise only. You can see it is more closer to the center line, and nutrition only intervention with changes, actually it is sometimes not much very promising. So you will get the overall outcome when it comes to the intervention of exercise plus nutrition together. So this is another research they have done actually. You can see the changes of weight in response to 12-month diet only, control, exercise, diet and exercises together. You can see the positive results, and also the how it's been significantly different and significantly positive compared to the control or exercise only or diet only the interventions. So there's another, I think I'm coming to the end of my lecture now. There are only 3 slides remaining. So this is something called obesity paradox. Some people try to say the fat and fit is another concept. So you don't need to be fat and fit. Well, of course, this is done. Actually, these concepts came on epidemiological data, because epidemiological based data, because they found the individual with established cardiovascular diseases, higher BMI levels are associated with better survival rates compared to those with lower body weight. So, but that is only the epidemiological based data. We don't know the reverse causation, how it been happen. So therefore, I mean, anyway, at the end of the research, they have found anyway, even if you more towards obese, or maybe your body fat is higher, but benefits are there when you are doing the exercises for all cause of mortality. So one should not forget this phenomenon, because sometimes it is not actually the obesity, but when you look at your body type, there are 3 different body types, and you get the ectomorph, which is thin and tall, and endomorph, which is kind of a stocky type body shapes, and also mesomorph is in between. Sometimes you might come across with people with endomorph who try to put it in the obese category, but which is not the real fact. But if you really go through their fat percentage, it is not that much. But you have to be very careful when clients or the patients comes with this category. Don't put them in the obese category, where that is their original body somatotype. So we have to be very careful. Otherwise, you will go in prescribing exercises and you will not get the proper results. And there are some complications of the exercises, because I'm not going to highlight, because exercises always does not give you the pleasurable feeling. Sometimes you might get with muscle soreness, and maybe the delayed onset of muscle soreness, injuries, fatigability. Sometimes people who have exercise-induced bronchocristitis or asthma can be triggered, and dehydration, cramps, and all these things can happen. So you have to be very careful. So my summary: so exercise and physical activity has shown benefits on overweight and obesity in terms of weight reduction and improvement of overall health parameters. So we always advise to follow the FIT protocol as I described, and always try to customize your or improvise methods or modified exercises for obesity and overweight people, because otherwise you already know now what is the problem when they engage in normal activities, and multidisciplinary approach, because we cannot maintain as sports medicine or other specialty only by prescribing the exercises, but you have to incorporate it other, maybe occupational therapy, maybe dietary intervention, especially medical dietary nutrition intervention, and especially the psychology and so many other areas which we have to think of and doing as a multidisciplinary approach. And thank you very much. Sorry for these slides, maybe because it's when it's converted to their levels, they are the mode.
Thank you, Vasila. It's a very informative lecture. I just want to know, I mean, we come across so many children with obesity disease and main problem is like, I just want to know when we find
Yes, ma'am. Definitely,
so
you can refer.
signs of the delay.
No, because yeah, I mean, you can go by the children's the overweight category or the BMI. That's more or less the same as BMI when it's come to the adults. And you can refer the patients to sports medicine clinic, and we have a special clinic, obesity pediatric clinic, Wednesday afternoon at Teaching Hospital, Peradeniya. Is Dr. Vasana Kiridana madam is handling, and there we actually intervene in all these three aspects: dietary, the other, finding of all the other metabolic syndrome and all, managing all these things, and with the exercise therapy as well. So even if you send it to the our sports medicine unit here, we can address the issues.
Sir, thank you very much for the very good updating lecture. Actually, evidence-based. Very important, this scientific world. When we do some lectures, it uses the evidence and related to the clinical outcome. And I think it is helpful to all of us. For our day-to-day life, all of us are very busy people. Thanks to COVID, now we are going home very early. And thanks to COVID, we were lost weight and involved a lot of other physical activities, I think. Now, actually, it's a blessing as well. I also, COVID has some problem as well as a blessing. Now, before I conclude this session, actually, I'll give you an announcement. We have a health camp. It's coming Saturday at the Poya Day in Kadugan now. This is our third health camp. If anyone is wish to join, they can help us to join there. And as well as if you have any medication to donate to the that patient, please hand over to the KSM office. We can make use of that drugs to prescribe that and hand over to the patient. That's the first thing. Second, I'm again reminding the tuberculosis, the certificate course on tuberculosis on 30th and the workshop on brain death on 21st. Okay. Now, thank you very much. I'm very happy that we had a very good audience now last few weeks, but and all the lectures, and actually it's encouraging. And last time was I request all the consultants to motivate your medical officers to come here and to learn without paying anything. It's just someone is a lecturer is prepared and come here and giving lecture. So this is a very, very helpful thing in this country. Other part of the world, you have to pay. No one can come and listen to lectures like this without paying. So here is a free teaching and free education. So please make use of it. And KSM with all the hardship, we are doing these things to helpful to educate our doctors and medical officers. And now, thank you very much, Rachel, again, and a very nice lecture and very good lecture. And as traditionally, I get to hand the certificate of appreciation for this lecture.
Saya නිකම් ලොග් අවුට් වෙනවා නේ සර් රෙකෝඩින් එකේ මොටෝ වෙනවා නේ සර් රෙකෝඩින් එකේ බුක් කරන්න දෙන්නේ හරි සර් මම ලොග් අවුට් වෙනවා ඔන්න එක තියෙන සර් ඔව් විනාඩි 62 විනාඩි 67ක් තියෙනවා සර් හෙලෝ මැඩම් ඔව් එතන ඉන්නේ ලොග් අවුට් වෙන්න 10 meeting